So this is a really interesting study. It came from some basic science research that was done at Memorial Sloan Kettering by Ron DiMatteo. And what he actually showed is that when tumors or gastrointestinal stromal tumors respond to imatinib, there's actually an immune-mediated response that is very important. We've also found that when resistance develops to drugs like imatinib, it's also an immune response that can actually cause that resistance to develop. And there was some basic science work that showed that if you can actually use a drug like a tyrosine kinase inhibitor to allow for some killing within the tumor, and then add drugs such as a checkpoint inhibitor or drugs like Yervoy, you can actually improve the immune response that happens within a tumor. So this is a phase 1 study where we were actually combining dasatinib with ipilimumab. Richard Carvajal at Memorial Sloan Kettering was the primary investigator for this, and the initial part of the study was to find the correct doses of the two drugs. And it's an interesting proof of principle in a disease that, although we have good primary treatments for, when the disease begins to develop resistance, it's a very difficult disease to treat. And so we're hoping, as we move forward now into the phase 2 study, that this may be a new option for patients with gastrointestinal stromal tumors.